Hello and welcome once again. A new COVID variant is back that threatens to spook India and the world. And also back is the Doctors' Roundtable. As Omicron becomes the latest threat, several questions are swirling around the variant and what needs to be done to stay safe. To answer the most frequently asked questions, joining me on the Doctors' Roundtable, Dr. Shahid Jamil, one of India's leading virologists, joins me. Dr. Subramaniam Swaminathan, Gleneagles Healthcare Department, joins us. Dr. Hemant Thakkar, Mumbai-based leading physician with us. And Dr. Sanjeev Ahuja, pediatrician, joins us at a time when children are also under the focus. But first, take a look at just why Omicron is being seen as a potential threat at the moment.
India continues to be on an alert against the super mutant coronavirus, the Omicron. The variant that has caused a surge in South Africa has not spread in a big way till now in India. Since the emergence of the first 2 weeks in Karnataka, the variant has been detected in 5 states. The number of cases has crossed 30. Maharashtra has maximum Omicron cases at 17, followed by Rajasthan with 9. Gujarat stands at about 3 cases. The good news is that none of the cases are severe in nature. But the government has a word of caution. It is advocating strict use of masks to prevent a new wave.
एक जो हमारा जरिया है अपने आप को बचाने का, मास्क के द्वारा जो हम कह रहे हैं कि यूनिवर्सल वैक्सीन है, सोशल वैक्सीन है, हर वेरिएंट के लिए इफेक्टिव वैक्सीन है। तो विनती यह है कि ये जो सिचुएशन ऐसे चली हुई है, ये महंगी पड़ सकती है।
Meanwhile, the Delta continues to dominate and is causing maximum hospitalization. India, as a precaution, has put off opening of the normal commercial flights till 31st January. Threat of new variants has prompted many countries to take severe measures. The World Health Organization has said that Omicron has spread to 57 nations. The United Kingdom, which has detected over 800 cases, fears 50% of all COVID infections could be Omicron in the next 2 to 4 weeks. The European Union says it is closely following the Omicron threat and whether new vaccinations will be required to fight it.
At this stage, we do not have enough data on the impact of this variant on the effectiveness of the approved vaccine, but we are continuously scanning the horizon to gather evidence in this regard. In any case, we are preparing to take rapid action should the need arise. The companies that market COVID-19 vaccines are required to submit the results of their laboratory tests to determine the level of neutralization for Omicron and discuss the possible options with us.
The emergence of new variants have also now reignited the debate over a need for the booster jab in India. Experts have suggested vaccinating people with weaker immunity before a more deadly variant hits shore. Bureau Report, India Today.
Let's go then straight to the Doctors' Roundtable. The first big question, and you, the viewers, can send in your questions also. What makes Omicron a big concern? Dr. Jamil, as a virologist, why don't you take that? Is this being exaggerated as a variant of concern, or do you believe it is a real threat?
Well, what's worrying, Rajdeep, is that this particular variant has the most number of mutations that have been seen so far. It has also shown phenomenal speed of increase of infections, at least in areas where it emerged, Southern Africa. So those are the concerns. What we don't know at this point is whether it causes more severe disease, whether it's going to evade pre-existing immunity that is derived from vaccines or prior infections. All that work is going on. At this point, the concerns really are based on what we know about other variants. But I must caution that just more mutations doesn't mean a more severe virus.
You know, that's the question that I wanted to pose to you as a follow-up, doctor. is Omicron more transmissible than Delta? Is that clear? And what are the implications of these mutations? 52 overall mutations, 32 in the spike. An average viewer wants to know what are the implications for them, and is it potentially more transmissible than Delta, or is it too early to say that?
Well, the data right now is showing that Omicron may be more transmissible than Delta, but all that data is essentially coming from one region. Whether the transmissibility is going to be as much in other parts of the world, we don't know that yet. At least that hasn't come about.
Okay.
If you look at the past 4 weeks, South Africa has shown an increase of about 80%. Whereas, other parts of the world, India, for example, has shown an increase of only about 1%. So it's really not clear at this time.
Okay.
The other question about more mutations,
yes.
Again, more mutations doesn't necessarily mean a worse virus. The picture that is emerging now is that it's likely to be more transmissible. The jury is still out whether it's going to be escaping vaccines, whereas whatever results are coming from South Africa suggest that the diseases it causes is less severe.
Okay, so that, you're giving us the big picture at the moment. Let's turn to the symptoms, Dr. Subramaniam. Are the symptoms of Omicron very different? What are the new symptoms that we are seeing so far? Because the general impression is the symptoms are mild. If Omicron is, are the symptoms mild, and what are the symptoms that we should be looking for, Dr. Subramaniam?
I think, like the previous speaker spoke very nicely, I think it's still a work in progress, and therefore we don't have all the information that we require to make any clear decisions. Number one, yes, it does appear that a lot of people are getting mild infections, but having said that, let's also note that hospitalizations in Ground Zero, which is Gauteng province, has gone up by a factor of 12 times in the last 3 weeks. So hospitalization is rising very fast, although we haven't had major issues with regards to death as yet. So that still remains to be seen. Now, as far as symptoms are concerned, yes, less people are reporting fever as per the preliminary data that we have. We don't have very good detailed data on that. More people are presenting with unusual symptoms like body ache and fatigue and headache. And also of note, it's being noted very clearly that previous infections with COVID does not seem to give you any protection against developing COVID with Omicron. So those people who are banking on natural immunity are going to be a little bit of a hole, because Omicron doesn't really respect natural immunity. On the other hand, if you look at the data from Shwane Metro in Pretoria, patients who have had a vaccination, adequate vaccination, which is 2 doses, did not develop oxygen requirement. So that is definitely a very good sign. But having said that, it requires 2 doses.
Doctor, if I can just get clarity, are you saying that people who are recovering from COVID earlier can also get infected? Therefore, there is no guarantee that because I had COVID earlier, I won't get Omicron. That's what you're saying. But if I'm vaccinated, less likelihood of me being hospitalized. Am I correct?
At least you are not likely to require oxygen, meaning you're not likely to get severe disease. From the patients that they had in the hospital on oxygen, almost all of them, practically all of them, were patients who were under-vaccinated or unvaccinated. So it does appear that vaccination is protective.
I'll come to vaccinations a little later, but Dr. Thakkar, your first thoughts on a question that is being asked by a number of people. Can we safely say that Omicron does not cause serious illness? Most of the symptoms remaining mild. Is that reassuring for us at the moment?
Definitely reassuring, because the data from Africa and even from a few sporadic cases elsewhere shows that the disease is mild, the fever is hardly any, the respiratory symptoms are also mild, oxygen requirement and ICU requirement is also not there. So remember, to add to Dr. Jamil's answer, when a virus mutates, it can mutate to strengthen or it can mutate to weaken. So you could have more transmissibility, but not necessarily when you change and mutate will you become more lethal. In fact, science and history has shown that mutations can even weaken the virus as the pandemic chugs along. So I think we don't need to worry about severe symptoms, but we'll have to wait and watch because there is an uptick in the hospitalizations in South Africa. Now, one doesn't know whether it's only because of no vaccination or under vaccination. But I don't think Omicron is going to produce very lethal, life-threatening problems as of now.
Are you saying, and this is a question posed, if Omicron is more transmissible as many believe, but milder than Delta, is that good or bad? Dr. Thakkar, does that mean that if I were to get Omicron, it would be milder? It might also give me the antibodies, increase my immunity. Is that possible?
First of all, because it is more transmissible, it is quickly spread from person to person. So it will take away 14 days of your productive life. If you have not had COVID before, you could get a little more antibody production with some more immunity. And definitely an infection of the virus, however mild or severe, is definitely going to have a run on your body, on your immune system. So at all costs, you must learn to avoid it. So you can't take it lightly and say it's a mild infection. You have to observe all the precautions. Those not vaccinated should run for the vaccine, and your masking and distancing is a sine qua non. You have to go ahead with it.
Just very quickly, Dr. Thakkar, to understand this in terms of symptom, loss of smell, is that a cause of worry? Or if I get a body ache today and a mild cough, is that what should worry me? When should I go and see you or call you up?
It seems that Omicron does not produce loss of smell and taste so much. So body ache, fatigue, headache, mild fever is something which you should look out for. And then you should ring the bell and get your RT-PCR test done.
Okay, let's come to a critical issue, which is at the moment a worry in South Africa and possibly for the rest of the world. Are children more susceptible to Omicron? Dr. Ahuja, your sense as a pediatrician, are children more susceptible? Is there a fear that children who are unvaccinated could be susceptible?
Yes. So this fear has been there for a fairly long time, because even now in most countries, or rather many countries, including ours, we have not been able to start COVID vaccination for the below 18 year age group. And we are hoping that it starts very soon, because whether it's the older Delta variant or any kind of mutated virus, the main weapon that we have with us is adequate vaccination. The good thing that what we observe in clinical practice in all these months is that children who do have COVID, I would say they are susceptible to catching the infection because it is airborne, and most families where the adults have COVID infection, the child also does get infected. But the clinical symptoms are almost always very mild. There is a mild fever, some amount of cold and cough or respiratory symptoms, a little bit of reduced appetite. Some of them have diarrhea, vomiting, symptoms which are similar to most other viral illnesses in children.
No, but are you saying, doctor, that the time has come to give vaccines to the 12 to 18 age group? I know Aditya Thackeray in Maharashtra, for example, has written to the center saying that reduce the age for vaccinations to 15. Do you believe 12 to 18, as the Indian Medical Association is calling for, it's time to push for vaccinations for them, or continue to focus on the most vulnerable over 60 and comorbidity groups?
Yeah, see, fortunately, more than 50% of our vulnerable population has already got at least one dose, and probably, I think, if I'm not wrong, more than 80% of the population has at least got one dose, and 50% have received both the doses. But definitely, if we reduce the time period between the two doses for adults, that is, instead of having a gap of 12 weeks, if we shorten that period, then a larger number of people could complete the two doses sooner. And I think children should be vaccinated, at least the ones who have comorbid conditions, like children who have a congenital heart disease or those who are on immunosuppressive therapy, because those are the ones who might suffer in case there is an outbreak with this new variant or even otherwise. So for all age groups, including the pediatric age group, vaccination is extremely important. And we should be able to, achieve that if the vaccine is, made available for this age group at the earliest.
One very quick follow-up, Dr. Ahuja, is long COVID affecting any children that you've treated? Are children at all getting long COVID?
See, most children have a very self-limited illness. Some of them suffer a few weeks later with this multi-inflammatory syndrome. On and off, we see cases of that in practice, but they do respond well to treatment. And mortalities or hospitalizations in children have not increased even in the last few months.
Okay,
so even in the last 3 weeks, where the number of cases being hospitalized have increased, the pediatric admissions, need for oxygen or ICU beds in the pediatric age group has, as of now, at least not increased. So we are hopeful that the disease remains mild, even if it's with the Omicron variant. But definitely vaccination is a tool that we have to get into.
Let's take that vaccination question right around the table. Do you believe that the time has come to give vaccines to 12 to 18 age group? Is an important question. Dr. Jamil, you tell us, where do you stand on this? Has the time come to reduce the age group?
Well, the purpose of this vaccine is not to prevent infection. The purpose of the vaccine is to prevent severe disease. If you had enough vaccine available and if you had the capacity to deliver vaccines very, very quickly, which I believe India has, then I would say, yes, go ahead with 12 to 15-year-olds. But you must not do it at the cost of vaccinating adults who get more severe disease. Ideally, yes, open it to children 12 to 18, but not at the cost of others.
Dr. Subramaniam, you want to weigh in on that?
So let's look at the data. If you look at the data that's been published from Europe, where they're in the throes of a bad outbreak right now, where hospitalizations are going up really across Europe, there's clearly a demarcation looking at dual vaccination. What has been shown is that in all countries, hospitalization cases are going up. But mortality only goes up when the dual vaccination is under 70%. Dual vaccination, not single. Single vaccination is hopeless. We are about 45% dual vaccination, 75% single vaccination. Basically, we are only 45%. We are nowhere near what is required to kind of bring it down based on European data. I agree this is not necessarily what should happen here. But the trend in Europe is very, very clear. 70% is what is required to keep the mortality down. So to me, it is very clear that the adults need to be pushed with regards to vaccination. Second, let me put this point in. Shwane Metro also showed excess hospitalization with children with COVID. But the average duration of hospitalization was only 3 to 5 days, which basically means although children do get Omicron, they get it very, very mild and really nothing much happens to them. While I believe it is necessary for their physical and their mental health to get back to school and their education, which is really badly suffering, I think at this point, the most important thing is to get it to as many adults as possible in an effort to mitigate the possible fallout that could happen if our immunization numbers are not adequate.
So you're saying despite Omicron, priority should still continue to be given to ensure that adults are double vaccinated, increase 45% to 80, 85%, then go to children. So in priorities, adults first, then children. Am I correct, Dr. Subramaniam?
Absolutely. This is a departure from where I was 2 weeks ago, basically because the numbers have forced me to change my opinion.
Okay, that's interesting. Let's turn to another contentious issue. And Dr. Thakkar, I know you've written about this. Has the time come for booster doses? You know, there is so much, many of us have taken vaccinations in the month of May. So it's about 7 months since we took our vaccination. Many health workers, I know my son, for example, they were vaccinated early between January and March. 9 months have gone. Should health workers, again, a demand of the Indian Medical Association, get a booster dose right away?
So if you see today's Times of India editorial, which I have written, I have talked about boosters and how you must boost and not boast about it. I agree with the demand of the health workers and the frontline workers that due to the flaying immunity, the falling antibodies, and the fact that they are likely to be exposed even to Omicron, a time has come when we should seriously consider boosters. However, the anniversary of our vaccination will be early next year. So I am assuming that 8 to 9 months is maximum what has gone by, even for the healthcare workers. So I think the government, who is considering booster officially introduced all over the country, would probably need to start this in early January because a booster is important. Like in influenza, we need boosters, and a mix and match booster would be better. I'm hoping in January we would have more Indian vaccines available, which would have a different content. So the mix and match booster would make more sense. But a booster would sooner than later be required.
No, when you say mix and match, are you saying that if I've had a 2 Covishield dose, my third dose should necessarily be a Pfizer and mRNA vaccine?
I'm not saying Pfizer or mRNA, but I'm saying that if you can get a DNA vaccine like Zydus, and if you can't get that, then use Covaxin, because you get better or more hybrid immunity. That's what science has shown if you have a mix and match. Of course, if you have the luxury of getting a Pfizer or an mRNA vaccine after a vector-borne vaccine, that's even good. But you must have a mix and match if you can. Having said that, if you do not have a mix and match, then I would give the 2 Covaxins a Covishield and the 2 Covishields a Covaxin, and that too would suit the purpose very well.
You know, interesting. Dr. Jamil, you want to weigh in on that? Because there is this whole debate about boosters. Should we be, again, waiting till the adult population is double vaccinated? Should adults over the age of 65, senior citizens, now go ahead and push for boosters?
Rajdeep, again, it's a question of risk versus benefit. The risk is largest in healthcare workers. The risk is largest in the elderly. But again, starting with boosters without adequate 2-dose protection to a larger section of the population does not make much sense. So I would say decrease the duration between the 2 Covishield doses from 16 weeks to 12 weeks. That will speed up things. We no longer have any shortage of vaccine doses. The second point is about heterologous boosting with another vaccine. I agree completely that we must do heterologous boost, primarily because 88 or 90% people in India have received Covishield. And a third dose of Covishield over existing 2 doses is unlikely to be of much benefit, simply because of the way this vaccine is made. Ideally for that, you must give either an RNA vaccine or a protein vaccine as a boost. And I might remind that there are 2 protein vaccines that India has capacity to make. The Novavax vaccine by Serum Institute and another vaccine called Corbevax by Biological E. Both have undergone tests. Both are waiting approval by the regulator. I think that should be sped up, and especially the Novavax vaccine. Serum Institute has the capacity to make almost 1.5 billion doses.
No, but are you saying, Dr. Jamil, that I must wait till Novavax comes for the booster?
No,
as of today, if I've taken these 2 Covishield vaccines, you're saying something important, no point taking a third Covishield.
No, I don't think a third Covishield is going to do much good. You will be wasting that vaccine on a booster when you should actually be using it to immunize people who have not had either 1 dose or both doses. So focus on that.
Okay.
But, speed up the process for the other vaccines, which we already have capacity to make. And there is, of course, the DNA vaccine, which we have not utilized so far.
Interesting. Dr. Ahuja, among children in particular, do you see a vaccine in the horizon which children can take soon?
Yeah, so as all the speakers said, the priority has to be the adult population because they are more prone to get serious illness. Children, so far, we have seen very mild illness, so they come last in the list. But if, it's a question ultimately of demand and supply. So if there is enough number of manufacturing of vaccines, then I think every human being of all age groups should eventually get it. Priority obviously goes to adults.
Okay.
Priority goes to finishing the second dose before considering a third dose, because we don't have maybe enough, data or strong reason to give a third dose. But healthcare workers, again, their doctors, nurses, paramedics should be the first priority.
Okay. You know,
Children
I think
so
it's
far-
clear that we've
Yeah.
got a prioritization in mind, and we've got the booster. The general view of booster is mix and match. To use what Dr. Thakkar
Yes.
said, mix and match. We need to wait perhaps therefore for a little while. But can we wait? And that's the question I want to pose to Dr. Subramaniam. The next question coming in, how long does a variant take to trigger a wave? Delta took 5 months. Do you fear that Omicron could spark off a third wave, as some are suggesting, Dr. Subramaniam? Or again, is it too premature to say that? Is that fear-mongering?
I would say it's inevitable. The point is, what do you call a
Inevitable.
wave? Let me explain what I mean by that. If you're calling a wave as increased number of detection of a particular variant, then that wave will happen. But if you're going to talk about hospitalizations or death, that's not a done deal. So you could have a wave of a lot of people developing a particular infection without necessarily breaking the health system. The point is, look at what's happening all over South Africa. The Omicron variant has literally taken over and shoved aside the Delta and the Beta variants within 1 to 3 weeks in almost all provinces. I've been looking at the genomic data very, very carefully. Look at what's happening in the United Kingdom. They're looking at the S gene target failure. And since alpha fell, it's practically rock bottom. And now that's also started rising. This basically tells me that outbreaks are happening everywhere. To expect that we will be different doesn't make any sense. The fact is that it is going to happen. The question is, how bad will it be? Let me just make one point very clear. The point is, this is going to be different from the Delta wave simply because this is going to be a wave everywhere at the same time. That basically means nobody is in a position to help each other, number one. Number two, even the law of numbers apply. Even if it's going to be a mild wave, if you're going to have too many people falling ill at the same time, then taking care of people is going to remain a challenge. For that reason, I think we just need to be prepared by getting ourselves vaccinated. To me, that's the common sense answer. And finally, one further point I just need to have to say. While we do believe that the adults should get the vaccine as quickly as possible, I think denying people who want to take the third dose, especially frontline workers and those who are vulnerable, doesn't make sense. We have a lot of people who are not interested in taking the vaccine, and these vaccines are just sitting over there doing nothing, and we are actually putting stickers on them saying their expiry date has been postponed a little bit. Why not give it to people who are literally begging for it and are probably going to benefit from it, given that there is a threat coming up? And remember, the shot takes 2 weeks to kick in. It's not like you take the shot and you're good to go tomorrow.
So
These numbers are starting to pile
you're
up.
telling me, Dr. Subramaniam, that if you're a health worker today, if you're over 65, even if I'm double vaccinated, because there are enough supplies of vaccines available and I want to take a third, take it. That's what you're saying.
I would say yes. Why deny them that right when nobody else wants to take the vaccine? See, these vaccines, people are going literally begging.
Right.
I know what's happening in Tamil Nadu. They're begging, saying, please come and take the vaccine. There are no takers for it. And there are people who are saying, we are vulnerable, give it to us. So it's not unreasonable or unscientific, like we have just discussed.
Right.
So why not give it?
You know, can I though, while you've said that some kind of surge is inevitable with Omicron, may I raise the question that many are raising? With high sero prevalence in India, will it act as a defensive wall? Dr. Jamil, as a virologist, the high sero prevalence around 67%, will it act as a defensive wall?
Well, it will act as a defense against severe disease. It will not act as a defense against getting infected. So people may still turn turn PCR positive. And very clearly, this variant is showing that people who have been infected previously, people who have been vaccinated and therefore are seropositive, are also getting this infection. So it's again a question of whether you're talking about infection or you're talking about disease. And much of this debate, people get confused very much between infection and disease. All these vaccines protect against disease. They don't protect against infection.
So what you're telling me, because my question follow-up was, how effective are vaccines against Omicron? You're saying vaccines will prevent hospitalization, but they will not prevent the infection. Am I clear on that, doctor?
Right. And this is not just Omicron. This is for any variant of this virus.
Okay.
All vaccines are designed to prevent disease, not infection. But if you're doubly vaccinated, if you've had a booster, you have more antibodies. you don't necessarily have different antibodies. You have more antibodies. And more antibodies mean that you can neutralize the virus better. And you also don't transmit it as well. So more vaccination, better it is. Okay. But to say that vaccines are working or not working simply based on somebody getting infected is wrong.
Okay. Let's turn from there to concerns being expressed over emergency oxygen. Dr. Thakkar, a number of people are writing worried about what happened in the second wave of COVID. Does an Omicron illness involve emergency oxygen requirements?
I will answer that question with the tail of your last question.
Yes.
I want to play optimistic. India has immunity and seroprevalence brought about by vaccination and by infection. So we have good hybrid immunity. We will get a lot of RT-PCRs positive, which is what Omicron does. And I echo the sentiments of my other colleagues. We will get very mild disease. If we get mild disease, which I think we will, if we are mirroring the West and South Africa, where's the question of oxygen requirement? They may be hospitalized for body ache and fever, but I don't think we will need to worry about ventilators and oxygen and ICUs. This is what is currently being looked at. And even Anthony Fauci from US has said yesterday that their data also shows very mild disease. But so I don't think we need to lose sleep about oxygen.
So you're saying don't worry about stocking oxygen. No one needs to stock oxygen.
The government needs to stock it. The government and health authorities need to prepare for it. But I don't want people running to chemist shop for concentrators or going to their attic and again polishing the concentrator straight away. I think be a little optimistic. Omicron should not become, oh my God, I did this.
Okay.
So I think we need to wait and watch.
Along with that, new COVID medicines, Dr. Thakkar, Molnupiravir, Paxlovid, are they effective against Omicron?
I'm quite sure they haven't been tested to give us data, but a few colleagues of mine who are using this definitely say that if you give Molnupiravir early in the disease, after all, the virus is a corona. It may have mutations. And because it has mutations, maybe the speed of recovery may not be as quick as a COVID-19, but the medication will definitely be effective. And stay optimistic. Every wave brings some new medication, some new vaccines. So we are not, I think, to be losing sleep over these things just now. We only need to be vigilant. We only need to not let caution go to the winds and be careful. That's all. Vaccinate. Okay. Please vaccinate.
Let's though come to taking out from what you just said. We just need to be vigilant and careful without being alarmist. Let's look at individual questions coming in. Ramesh is writing to me, Dr. Ahuja, should I be putting vacation plans with my children on hold? I'm taking my children on a Christmas, New Year holiday. Should I put my vacation plans on hold? I'm worried for my children, Dr. Ahuja. What do you say?
Right. So I think if you follow COVID appropriate behavior, which has become more and more, difficult to see nowadays, even going on a holiday into less crowded places, wearing a mask, not going into very crowded areas, and if the adults are doubly vaccinated, I think it should be how safe it can be in the present situation.
So you're saying
what is most important in the nutshell is that we have to follow the proper, masking and COVID curbs have to be followed, because all said and done, proper vaccination and COVID appropriate behavior is all that we have. If the worry with the new variant is that those who have had the infection in the past, they have a risk of reinfection because the antibodies which are there in them may not protect this reinfection.
But should my children also be masked on vacation?
Yeah, children who are over the age of 2 years can be taught to wear a mask. Okay. In fact, in our clinics, we regularly insist that children who are, over the age of 2 years, they wear a mask. In fact, ironically, sometimes the child is wearing the mask properly and the adult is wearing it at the chin. And children follow their parents and what they see around them. So I think if adults are masking themselves properly, not going for unnecessary crowded areas, they can, people are going around, and fortunately, we are not seeing severe disease. What we've always been discussing the last few minutes is that disease is going to increase.
Right.
The number of cases are likely to go up. But what we are concerned is with the deaths should not be increasing and the severity of disease, hospitalization should not increase. And we are hoping that that doesn't happen from the trend that we are seeing even in other countries now.
Okay. You know, the interesting thing is my nephew wears his mask better than I do. He's 8 years old. But should I avoid traveling to Europe? Dr. Jamil, you're in Oxford. Is Europe the worry? Someone is asking me, should I avoid traveling to Europe? Is it safer to travel domestically in India?
Well, I mean, I would worry more about the travel restrictions. I mean, I was supposed to travel to India last week and I had to put it off because of all the chaos at the airport and, 7-day quarantines, which would mean that I would essentially sit at home. So I think you worry more about the travel restrictions. But I would say that if you can avoid travel at this time, do avoid travel. I mean, it's not just getting to a destination. Remember, if you're traveling to Europe, you are for 8 hours in an airplane, which has recirculating air. And, you have to wear a mask all the time. If your compliance is not good, you have a better chance of getting infected if somebody has infection on the plane than when you are just out in open space. So I would worry more about that.
Okay.
My advice would be if you can postpone, it's better.
If you can postpone. Taking from your question, how can one keep safe at airports and inside the plane, Dr. Subramaniam? Because airports are crowded. There is a holiday crowd. Most Indian airports very crowded at the moment. How do I keep safe at airports and inside the plane when I'm surrounded by so many people, no social distancing?
Somebody asked what's better than presence of mind in an accident. The answer is absence of body. So the best answer, like Dr. Jamil said, is right now I have discontinued all travel. I have discontinued all physical meetings because the numbers are already going to start piling up. It just doesn't make sense for me to involve myself in an activity which I consider to be risky. So for that reason, I've already sent out an advisory to my group level saying all non-critical travel should be withheld for the foreseeable future till we know better. So I don't see it as a great investment unless there's a reason for the travel. There has to be a very good reason. If it is so, yeah, sure, you accept the risk and move on. But unfortunately, like Dr. Jamil pointed out, the point is there's so much recirculation of air, it doesn't matter how many HEPA filters they put into it. It just will not work. Unfortunately, if you look at it, there was this person who went to for anime convention in New York, and by the time they came back, all 15 of his colleagues also got Omicron. So the point is that Omicron transmission within a group is very, very fast. So sitting in a tinderbox like an aeroplane, to me, is just a rank bad idea. And everybody is saying this. Be in open spaces if you have to. Do not be in enclosed places like airports and things like that, where you have to be there for a significant period of time.
I'm just flying off for a wedding. You've just almost spoiled my wedding plans. I have to fly off for a wedding. So what should I do?
See, again, the point is that, this is the point. If you have one mask and there are two of you, it's more important for you to put the mask on the other person because you're negative. Remember, that person shedding is bigger a problem than you're shedding because you're negative.
Okay.
The problem is, as long as everybody wears a mask, it reduces the risk. Here's the problem. The government has already withdrawn the mandate to avoid food and drink in flights. So people are serving food. And when you eat, you invariably are spewing out lots of virus. And mask hygiene, even otherwise, is very, very poor. So I am not happy with the current situation as it is. That's why, like I said, I have withdrawn all travel from my personal end since the 1st of this month because I know things are going to start moving very quickly. And I have advised everybody that you better evaluate and see what needed to do.
Okay.
See, we are still in the honeymoon phase where we are taking off. The numbers will start piling, I suspect, from next week. Okay. After that, I would think it would probably be more than just tricky moving around.
Okay, you're offering a warning there. Should I stop going to the gym, Dr. Thakkar? All the things that I had started doing in the last couple of months, should I stop doing it, Dr. Thakkar?
I would say, like the offices and schools have deferred their activities by a fortnight or 3 weeks, you could wait till the 1st of January because we need to read how this Omicron transmissibility and transmission happens. Just because it's suspected to be a mild disease, you can't take law in your hands and go to public places. The aim, like I agree with my other two speakers, if you don't travel, it's the best thing. So if you gym within the house, that's the best thing.
Okay. Dr. Ahuja, do I, in a way, also stop going on any kind, stop taking my children to school? There's been a huge debate. Should schools open? Should that debate again be pressed? Should we press the pause button on that again, Dr. Ahuja, quickly?
Yeah, so see, we still don't have any idea on how this new variant will behave in the next few weeks. So as of now, it may remain mild, it may blow up into whatever proportion it can. So as of now, definitely mixing of children in crowded places, playgrounds, I think we should withhold as much as possible.
Okay, withhold as much.
It's too early to open up schools.
Okay, withhold as much as possible for now is what you're saying. Dr. Jamil, very quickly, does the new form of COVID, or I presumably they're referring to Omicron, hit people with any particular blood group more than others? Is there any evidence, Dr. Jamil, at the moment?
I'm not aware of any such evidence, Rajdeep.
And is there any evidence that those below 40 are more vulnerable than those above 40, Dr. Jamil?
No, I don't think so, because that comes from the initial cases in South Africa, but that could simply be a cluster effect. Okay. I don't think there's anything
Let
to it.
me come as we are entering into Christmas, New Year. Are you saying, Dr. Subramaniam, Christmas, New Year parties, office parties, strict no, avoid them, don't have them?
Let's not have congregations of any kind right now, because we might have to congregate for the wrong reasons after that.
Okay. Dr. Thakkar, do you agree with that? Should we wait a few weeks before we cancel engagement? A friend of mine, his son is getting married next week. The wedding planners are planning quick rapid tests outside the wedding venue. Is that enough?
I would, as of now, put a pause button on that and try and cut down the numbers. Inevitably, if the wedding has to go on, like you have to go, but you can cut down the numbers because you want to be safe rather than sorry.
Just linked to that, can current RT-PCR kits detect Omicron, Dr. Jamil?
Yes, I believe the ones that are being used in India are detecting it because they're not using the S gene. Even if they're using the S gene tests, anything that fails the S gene but picks up the other genes is an indication of Omicron. So yes, so far tests are picking it up.
How long do you think, Dr. Subramaniam, before we can say that the worst is over? Every time we feel that we are back and safe, along comes a new variant. Do you believe this is the last of it? Or Dr. Subramaniam, you would also press the pause button on that? I mean, when do we get back? Can I on January 3 open up offices in the way that we did pre-COVID?
January 3 is far too early, because the modeling would suggest that there's no way the wave is going to be over by the end of Jan. So, and also remember what Dr. Soumya Swaminathan said. We are now entering into a phase which is akin to a chronic phase or endemicity with COVID. Therefore, the fact that the vaccine inequity is so bad across the world, it is inevitable that COVID is probably here to stay, maybe not in such a horrible avatar, but at least in a milder form, it's probably here to stay. It's going to be probably something that we have to accept like influenza.
You're saying it's something that we have to accept. Dr. Thakkar, you've always said, Diwali will come next year, Ganpati will come, New Year's will come, Christmas will come, but there is COVID fatigue out there. There are friends of mine who are listening to your program, and one of them has just said, please tell Dr. Thakkar what's the good news.
Didn't you have a better Diwali this year as compared to last? You did. So you're beating the virus down. This virus is stubborn. It'll be beaten down slowly. And as Dr. Swaminathan said, we learn to live with the virus. Maybe the virus will learn to live with us. So the virus will mutate, it'll weaken, and we will have to take annual shots if push comes to shove. But definitely next year will be better. Diwali will be larger. Weddings will be more robust. Don't lose heart. Live within the bubble. Your bubble is already enlarged. Don't over-exceed and prick the bubble to get problems.
Let me ask all of you in conclusion, I don't know who wants to give the right answer to this, but is it Omicron or Omicron? I mean, the New York Times is saying one thing, BBC is saying one thing, Webster is saying one thing. Does any doctor know what is the right spelling, Dr. Jamil? Is it Omicron, Omicron? What is Oxford saying?
I think it's Omicron. It's a Greek alphabet, which is
Okay, it's Omicron. Dr. Thakkar, you said Omicron, right? You're in the American view. The Americans are saying Omicron.
A rose with another name would smell as sweet. Omicron or Omicron would be as deadly. So semantics doesn't deter anything.
Okay, I think on that note, we've listened to all of you, and I think again got a lot of wisdom from our doctors. I think the general message is be cautious, be careful. The virus hasn't left us as yet. Let's not have any irrational exuberance. At the same time, let's not panic. All of you have answered several questions, from booster doses to vaccines to RT-PCR tests to so much more on this show. Once again, thank you so much for sharing your wisdom on the Doctors Roundtable. And you out there, stay safe, stay well. God bless. Thanks for watching. Bye for now. Goodbye.